I never thought this day would come. The federal government is finally acknowledging the elephant in the room, and that is that we have an obesity and cardiometabolic disease crisis here in America. Lest I remind you, over the past several years, I talked about the importance of losing weight, improving your blood sugar control, exercise, getting vitamin D, and spending time in nature, while the federal government effectuated policies that discouraged exercise, that encouraged people to consume hyperpalatable, ultra-processed foods by ordering Uber Eats and takeout from their cell phones while they stay inside isolated. Both federal and local governments closed gyms, closed schools, closed parks, playgrounds, and were issuing citations for people leaving their homes. What did that do? We've talked about this. That worsened obesity, that worsened blood sugar control, that caused people to exercise less. And guess what that did? That worsened the cardiometabolic disease crisis, which allegedly the federal government is actually quite concerned about now. I'm going to play with you a clip from the Secretary of Health, Dr. Rachel Levine. Of course, her pronouns are she, her, as you can see from her Twitter profile. But let's hear what the Secretary of Health is talking about with regards to obesity and cardiometabolic disease, and why we should all care, and why we should do our part. And let me just pause here. I think it's quite interesting, the timing of this video, because when we had the attention of the entire world, we missed the critical opportunity. That's why I care so much about this, if you can't tell from my passion over the course of the last 3 years. We missed a critical window of opportunity to actually provide tangible ways for people to prevent the underlying risk factors for all sorts of diseases, especially for preventing severe COVID-19. We know from the data, 94.5% of people who got hospitalized had 4 or more underlying health conditions, all of which are preventable, most of which are related to metabolic health. But yet we didn't encourage exercise. We closed the gyms. We kept the liquor stores and cigarette stores and McDonald's open. Why did we do that, my friends? Because the Secretary of Health is acknowledging that we have a very imminent public health crisis, and that is obesity and cardiometabolic disease. So let's listen to this clip and talk more about it.
This work is very timely because our country is facing a genuine crisis of diet-related...
I thought the crisis was COVID. Anyway, here we go.
...related diseases. Heart disease, type 2 diabetes, obesity, and hypertension each affect tens of millions of Americans and are associated with increased risk of heart attack and stroke, the 2 leading causes of death in this country.
Now, most people are surprised to learn that cardiovascular disease and cancer, she kind of misspoke there. If we're talking about numbers and enumerating the top leading causes of death, it's heart disease and cancer. Most people don't know that actually claimed more than twice as many lives all throughout the COVID-19 crisis compared to COVID. Most people think the number one reason why people died prematurely is COVID. That is statistically not true. 1.2 million people died during the year 2020 and 2021. We don't yet have the data for 2022, compared to just 380,000 people each year during that same time period from COVID. So you have literally 4 times as many deaths from the combination of heart disease and cancer, yet you still had people going to McDonald's, drinking soda, eating sugar and flour, and skipping the gym while they wear the mask and stay inside and watch the news. But anyway, let's go on.
This crisis places a tremendous economic burden on our nation. Estimated healthcare costs associated with excess weight and obesity totaled nearly $173 billion in 2019. These burdens fall especially hard on communities of color, people living in rural areas and U.S. territories, and those living with disabilities, older adults, military families, and veterans. This National Nutrition Month, please learn more about healthy eating and how you can do your part to support healthy people, healthy communities, and a healthy nation for all. Please visit Dietary Guidelines.
Okay, I like the idea of including all sorts of people and encouraging sort of do your part to be healthy. But as you can tell, there is no tangible takeaways from this video. I mean, this is a government-produced video. Where's the encouragement for walking at least 8,000 on a minimum 8,000 steps per day, lifting weights 3 to 5 days per week, eating whole unprocessed foods, not consuming hyperpalatable packaged foods that include industrial seed oils and refined sugar? I mean, these are just basic things that we can all agree upon. You can be vegan, you can be vegetarian, you can be carnivore, you can be low carb, whatever, but let's just focus on the main things. And unfortunately, the government advice doesn't focus in on that. I went to the nutrition facts.gov or whatever the link is that was included in this video. And it was like a 110-page PDF that included a bunch of jibber jabber with no specifics on what people should actually be consuming. Yet, if you remember, I know you can remember the COVID pandemic, there was all sorts of specifics. Stay in your house, stay 6 feet away from other people, wash your hands, use hand sanitizer, wear gloves, wear 1 mask, no 3 masks, right? There was all these specifics, but why aren't we being specific with people about preventing the non-communicable diseases like diabetes, like high blood pressure, like obesity? We need to give specific, tangible aspects and let people customize from there based upon their dietary preference. Focus on protein. Make whole real foods from scratch. Avoid refined sugar. Walk 8,000 steps per day. Go to bed and wake up at the same time every day. These are simple things that we should be focusing on. And again, I guess I'm a little irritated by this because we missed the window where most people cared. Now people are like, I've gotten COVID, I survived, I didn't die. So on to the next. They don't really care. They're not thinking about the long-term prevention of diabetes, cancer, heart disease, obesity. It's this instant gratification culture. But again, we missed the window, the critical window of opportunity where I think we could have really impacted the prevalence of these conditions by emphasizing the fact and reporting honestly the characteristics of people who were actually dying during the COVID pandemic. And that is people who had blood pressure issues, people who had prediabetes, people who had obesity, people who had low muscle tone and frailty. Those are the reasons. And vitamin D insufficiency, of course, micronutrient insufficiency. Those were the reasons why people were dying. So why now are we just talking about obesity and metabolic disease when we could have been talking about this and really improve the health and the lifespan of people for forever? I don't know. I guess I get frustrated by this. It seems that it's a little bit too late. I guess late is better than never. But I'm a little disappointed that there's no actionable steps here that people can take. And we can agree to disagree on the minutia and the details, but focusing on protein, avoidance of hyperpalatable processed foods, eating foods from scratch, walking 8 to 10,000 steps per day, lifting weights 3 to 5 days per week, or some resistance training. It can be body weight, and prioritizing sleep and vitamin D and micronutrients. Like those are like 5-6 things that we can all be doing, and this could be a public health campaign, my friend. So again, I guess it's good that the government is talking about this and finally acknowledging that this is a major health crisis and that comprises the top reasons why people die. But it's a little late. I don't know. What do you think? Let me know in the comments, friends. As always, appreciate you tuning in. Thanks for hitting the like button. Have an awesome rest of your day, and we'll catch you soon.